Today we are going to be discussing attention deficit hyperactivity disorder, most commonly known as ADHD. What is ADHD? ADHD is a common disorder among children that can continue as you get older. Individuals with ADHD commonly have difficulty staying focused and paying attention, difficulty controlling behavior, and hyperactivity. Inattention, hyperactivity, and impulsivity are the key behaviors of ADHD. Here are some signs and symptoms you may notice in an individual who may have ADHD. Children may have trouble paying attention, focusing, and behaving at one time or another. However, children with ADHD do not grow out of these behaviors. Some symptoms of ADHD may lead to causing difficulty at school, at home, and with friends. A child who has symptoms of ADHD for 6 or more months and to a degree that is greater than other children of similar age are diagnosed with ADHD. Some symptoms of ADHD are lack of concentration, impulsivity, hyperactivity, inattentive, forgetfulness, fidgeting, making careless mistakes, acting without thinking, excessive talking, and easily distracted. Children who have symptoms of inattention may be easily distracted, miss details, forget things, and frequently switch from one activity to another. They may have difficulty focusing on one thing, and they may become bored with the task after only a few minutes, unless they are doing something enjoyable. Having difficulty focusing attention on organizing and completing a task or learning something new is also a sign. They may also have trouble completing or turning in homework assignments, often losing things such as pencils, toys, assignments needed to complete the task or activity. They also may not seem to be listening when spoken to. They may be daydreaming in class, become easily confused, and move at a slower pace than the other students. Children who have symptoms of hyperactivity may fidget and squirm in their seats, talk non-stop, dash around, touching or playing with anything and everything in sight. They have trouble sitting still during dinner, school, and at story time. They may be constantly in motion. They have a difficulty doing quiet tasks or activities. Children who have symptoms of impulsivity may be very impatient. They blurt out inappropriate comments, show their emotions without restraint, and act without regard for consequences. They may have difficulty waiting for things they want or waiting their turns in games. They often interrupt conversations or other activities. Some causes of ADHD. ADHD has biological origins that aren't yet clearly understood. No single cause has been identified, but researchers are exploring a number of possible genetic and environmental links. Studies have shown that many kids with ADHD have a close relative who also has this disorder. Although experts are unsure whether this is the cause of the disorder, they have found that certain areas of the brain are about 5% to 10% smaller in size and activity in kids with ADHD. Chemical changes in the brain also have been found. Research also links smoking during pregnancy to later ADHD in a child. Other risk factors may include premature delivery, very low birth weight, and injuries to the brain at birth. Some treatments for ADHD. There are currently available treatments focusing on reducing the symptoms of ADHD and improving functioning. Treatments include medication, various types of psychotherapy, education or training, or a combination of treatments. The most well-researched, effective, and commonly used medication treatment for ADHD is Ritalin, Concerta, Meditate, and Adderall. Medications can affect children differently, where one children may respond well to one medication, but not to another. When determining the best treatment, the doctor might try different medications and doses. So it is important to work with your child's doctor to find a medication that works best for your individual child. Some facts about ADHD. ADHD is one of the most common childhood disorders and can continue through adolescence and into adulthood. The average age of onset is 7 years old. ADHD affects about 4.1% American adults aged 18 years and older in a given year. The disorder affects 9% of American children aged 13 to 18 years old. Boys are 4 times at risk than girls. This figure shows the percentage of children aged 5 to 17 years old ever diagnosed with ADHD by sex. As you can see, males are more likely to be diagnosed with ADHD. This shows the percentage from 1998 to 2009, and it's still increasing. ADHD in the classroom. Kids with ADHD are eligible for special services or accommodations at school under the Individuals with Disabilities in Education Act and an anti-discrimination law known as Section 504. Keep in touch with teachers and school officials to monitor your children's progress. In addition to using routines and a clear system of awards, here are some other tips to share with teachers for classroom success. One thing you can do is reduce seating distractions. Lessening distractions might be as simple as seating your child near their teacher instead of near the window. If the student is near the window or the door, they may be very focused on what is going on outside the classroom. You can also use a homework folder for parent-teacher communications. The teacher can include assignments and progress notes, and you can check to make sure all work is completed on time. This is a way to have the parent involved in the classroom and with their child's education. You should also break down assignments. Keep the instructions for an assignment clear and brief. Breaking down larger tasks into smaller, more manageable pieces will be very helpful for the student. You do not want the student to feel overwhelmed in the classroom. You want them to feel like they can do the assignment that they are given. You should also give a positive reinforcement. Always be on the lookout for positive behaviors. If you see a student staying seated or not calling out or waiting his or her turn, you should offer praise instead of criticizing when he or she doesn't do this behavior. You should also teach good study skills in your classroom. You should model underlining, note-taking, and reading out loud to help your child in the classroom stay focused and retain information. You should also supervise your students. Check that your student goes and comes from school with the correct books and materials. You can also pair the student with a buddy to help them stay on track. You should also involve the school counselor or psychologist. He or she can help design behavioral programs to address the specific problems in the classroom. Here are some strategies you can use in your classroom to help behavior. One example you see here is a red, yellow, green traffic light. The students will each have a clip with their name on it. They will stay on green when making good choices. If they make a bad decision, they will take their clip and clip up to yellow, where they think about their choices. If their bad choices continue, they will clip up to red. This is where they stop and sit out and think about what they have done and why their behavior was not the correct choice. This is a way for students to be involved in their behavior. The parents would also be aware of their choices throughout the day. They would get home a letter so their parents can see what colors they were on the traffic light today. Another example is this behavior chart over here. This is also similar. I happen to use this chart in the classroom as well. The students each have a red, yellow, and green card. It is similar in the sense to the meaning of the colors. If a student makes a poor choice, they will change their card to yellow. If they then make another bad decision and continue and not change their behavior, they will go to red. However, if they are on yellow or red at the end of the day, if this teacher had noticed that the student changed their behavior, they could also go back to yellow. The parents would know of their colors throughout the day. If they were on red but switched down to yellow, the parent would also be aware of that. This is a way for the students to also be involved. You could also send home a chart so the parents are aware, and the parent would have to sign so they know how their child is behaving in class. This is also another chart you can use in your classroom. This shows your students' behavior throughout the week. So you can put a smiley face if they have good effort, they're attentive, and all work is completed independently. If they have fair effort, you put a smiley face that's not as happy. They're somewhat inattentive and they completed work with prompting. If they were not inattentive and they had poor effort, they did not complete work on time, you would put a sad face. This is a way for the parent to see how the student's behavior is throughout the week. And the parent would have to initial after every day, so they are aware of the student's behavior and are involved in the classroom. If you have a student that is very fidgety in your classroom, one thing you can do is get some toys for this student, such as a Slinky, Play-Doh, an eraser for your pencil, a little ball. These are ways to help the students stay in their seat. They will be playing with these objects on their desk, and it won't distract the students around them. This is a way for them to have their hands to themselves, and they are maximizing instruction for the whole class. Another thing you can do in your classroom is have an on-task or off-task chart. The directions say, as you listen to your teacher, try your best to pay attention and follow the rules. When the timer goes off, decide if you are on task or off task. This is a way for the student to be involved in their behavior and reflect upon their own behavior instead of the teacher making the decision on their behavior. If they thought their eyes were on the teacher, their lips were zipped, they were following directions, they're doing their work, they would check it off on the on-task side. If, however, they were out of their seat, they were not getting their work done, and they were talking while the teacher or another student was talking, they would check it off on the off-task side. At the end of all their checks, they would see which side had more checks, and that would be the side they won. So they would be able to reflect on their behavior during that activity. In conclusion, ADHD has become a common disorder amongst children. Students with ADHD face a lot of challenges. However, with the appropriate help and treatment, they can succeed. It is important as an educator to be aware of the symptoms and what they can do in their classroom to help this individual. It is also essential for the teacher to understand and know all their students because no individual learns the same. I hope this presentation on ADHD was very helpful, and I thank you for listening.